Welcome back to American Morning. She saw her own hand lying on the ground, a grandmother who had a horrific accident with a power saw.
I didn't see this one coming. Somehow this story does have a happy ending, I'm told, because of a surgery that really has stunned the medical community. Our chief medical correspondent, Dr. Sanjay Gupta, back with us right now. This sounds fascinating.
It is, and you know, there are good stories that have happy endings here because you know the marvels of medical technology sometimes. Exactly as you guys said, she was using a power saw. She had an accident and essentially cut her own hand off using this power saw. A pretty clean cut. I think we have an X-ray to show you this, and take a close look. It's just an X-ray, obviously. The bottom is sort of cut off there, quite literally and figuratively there, but you can see she noticed this just to give you an idea of how much shock she was in. She didn't know it was her hand until she saw her wedding ring, which you can see there in the X-ray, on the hand. And she said, well, that is my hand on the ground. But then what happened next was important. She was able to get to the hospital where doctors actually specialize in this exact kind of thing, microsurgery, being able to reimplant, in this case, hands, but they do feet, they can do fingers. And she moved along quickly. Really quick, take a look at this animation here. One of the big things is actually reattaching these tendons to try and give her some range of motion. They use the anchors like you see there, put the tendon through, lock that all in place. Again, that tendon was cut along with arteries, veins, nerves.
Is this new technology, or I mean?
Well, you know, it's interesting. So much of the technology, you can see at the end there, this is sort of the finished product.
Wow.
And you can see some of the soft tissue swelling. You can see there.
And it works just fine?
And so here's the operation took about 8 hours. About 12 hours after that, she was able to start moving her fingers.
Wow.
Gosh, that's incredible.
It really is, and it speaks to not only the surgical technique, which is not new necessarily, but improving constantly, but also that she moved quickly and her family moved quickly. You need to do this type of operation within 12 hours or so to be able to get that sort of function.
You were talking about the soft tissue swelling, and this is one thing that I'm starting to understand about any kind of reconstructive surgery or reattachment. The science of it, the mechanics can be engineered, but the symptoms sometimes go on for a long time. Is she back to normal? Has that swelling come down?
The swelling is still going to be there, and it'll take her some time to get back to normal in the sense that.
How old she is? We said she was a grandmother.
She's a grandmother. I don't know exactly how old she is, but about 2 years of rehab they say she's going to need.
Wow.
And then she should get back, and there's plenty of stories where people are back to doing the things that they did. She may have some numbness, may not be exactly the same as before, and obviously the scarring, but you know, it is pretty remarkable to be able to, arteries, veins, nerves, tendons, obviously the skin, the soft tissue, the muscles.
Incredible.
I've never heard of this happening. I mean, I'm sure it has,
well,
but
you know, because we talk so much nowadays about doing hand transplants and face transplants and things like that.
That's right, yeah.
But this is much more common. If someone were to actually, because you have these sorts of accidental injuries, and this can be, it's a bit of an optimistic thing.
What should you do? If that ever happened to you, some limb comes, or digit gets unattached.
Right.
Do you freeze it? Do you call 911? What do you do first?
The lay wisdom probably works here. You don't freeze it, but you keep it cool. You don't want to freeze the edges of the tissues. Put it in a nice cooler. Get to the hospital as quickly as possible. Let them know you're coming. They usually have the operating room starting to prepare, to be ready for this. They may even start operating on the hand or the digit before they start operating on you to get the tissue all ready.
Get there fast.
But you want to move quickly.
What a fascinating story.
And a good ending, as you say.
Yes,
I like that.
We like that.
Sanjay, great to see you.
Yes.
Still to come this morning.